Identify and manage common newborn conditions holistically. Stay tuned because today you will discover holistic techniques to support birthing parents postpartum and ways to support infant immune systems. Hi there, I'm Dr. Krista Burns, founder of the American Posture Institute and your host for Peds Week Online, the Pediatrics Virtual Summit for Healthcare Professionals. It's an honor to introduce our next guest presenter. Dr. Ellie McGregor, founder of Middle Path Integrative Pediatrics and the host of the I Heal Kids podcast, blends integrative osteopathic and functional medicine to support children's health. Fellowship trained by the Andrew Weil Center and Kalish Institute, she welcomes new patients from primary care and functional medicine consults. Today, she'll be sharing with us From Womb to World, Holistic Newborn Care for Optimal Health. Dr. McGregor, thank you so much for joining us today as a speaker for Peds Week Online. Please take it away.
So like Krista said, we're going to be talking about holistic newborn care today for optimal health. And who the heck am I? So again, I'm Dr. Ellie, and I'm the founder of Middle Path Integrative Pediatrics, the I Heal Kids podcast, and I also do telehealth in North Carolina, California, and Florida. South Carolina, you are coming soon. What the heck even is holistic care? So just to sum it up, pediatric holistic care addresses physical health, emotional health, social, and spiritual needs, and it focuses on well-being rather than just on the illness. So, in holistic pediatric care, I like to emphasize patient preferences, coordinate care, educate and prioritize comfort, emotional support, and family involvement, which sometimes can be tricky. And of course, I blend holistic treatments like lifestyle and alternative practices with conventional pediatric care. So newborn care actually starts in the pre-pregnancy phase. So I'll be talking to you in that framework today from the pre-pregnancy phase through to the newborn phase. And we'll see what we can get covered in this short time. So we'll have questions at the end, but I'll do some brief pointers as we go through. So if you're a provider that's working with pre-pregnant patients and they're saying to you, hey, I'm thinking about getting pregnant, we're trying all of that, and you're not someone that can do any kind of screening, like blood work and that kind of thing, you do want to refer them so that they can have optimal health. So people like their PCP or their OBGYN can do this kind of work, where these pre-pregnant people can get screened for things like anemia, vitamin D deficiencies, other vitamin deficiencies, as well as thyroid issues, issues with STIs if they need to be screened or treated for those, as well as other health screenings that they need to make sure that the baby is healthy. If you're also a provider that works in drug addiction, you may want to bring that up as well. Many patients actually do want help for drug and alcohol use, but they're too afraid to ask. So make sure that you do ask about that if you have a relationship that supports that question. And if not, you may want to cultivate one, right? Weight management. So this is a great area, especially for functional holistic practitioners. Many of us work in the weight management and lifestyle worlds. And so, healthy weight actually reduces the risk of prematurity, stillbirth, gestational diabetes, hypertension, preeclampsia, C-section, and it supports healthy breastfeeding. So if you are working in that world, make sure that you do address it. In my world as a functional practitioner, when I'm working with people who are pre-pregnant, I also like to test the hypothalamic pituitary axis to make sure that that is functioning well. I'm checking for hormonal imbalances. I like to do cycle mapping, especially for patients that aren't ovulating on schedule. Do gut testing for dysbiosis and infections, and also make sure I'm testing for nutritional deficiencies as well as all of those lifestyle concerns. And you can see the list here that we like to work on prenatally, and I won't read that to you, but we'll go through those topics as I address the slides. So nutrition. So once someone becomes pregnant, what do they need? And nutritionally, there's actually a lot of studies on this. In fact, one study showed that 66,000 women in Norway who were eating what they called a prudent diet, which is one that's rich in fiber, vegetables, whole grains, and water, compared to a Western diet of processed foods, was linked to a reduced risk of preterm birth. So if you're not sure where to start with diet in your pregnant patients, just recommending the simple, prudent diet can be really helpful. It's also helpful to recommend DHA, which the dose for pregnant people would be 200 milligrams a day, or that would also equal 2 servings of fatty fish per week, so salmon, sardines, or mackerel. And the reason that we want to recommend this to pregnant people is because in the fetus, it supports healthy brain development, healthy eye development, those rods and cones in the retina, testicular development, and it reduces preterm delivery risk. There's also some evidence that it helps with allergies through those Th1 and Th2 pathways. Another supplement that pregnant people should take is folate. So folate protects against neural tube defects. And the dose for that is 600 micrograms a day, unless that pregnant person has already had a baby with a neural tube defect. Then you'll want to recommend 4 milligrams a day. And ideally, you'll start that 3 months before they even get pregnant. And again, that's to protect against neural tube defects. One note on folate is that many people have the MTHFR mutation, and those people don't convert folic acid into folate very well. So you do want to recommend the folate versus the folic acid supplement, especially for those people. But again, many people don't know if they have that mutation. For pregnant people that have anxiety and depression, some people don't choose to take a pharmaceutical medication, and it is safe to use amino acids like tyrosine and tryptophan, and that helps support the serotonin and catecholamine production in the brain. So you can use those instead. A quick note on if you're a functional practitioner like I am, what can you do in pregnancy? Well, you can certainly give a prebiotic or probiotic, a multivitamin, omega-3s, pancreatic enzymes, gallbladder support, and minerals. But do make sure that you are making sure that the dose is safe for pregnancy. And this list isn't from me, this is from Dr. Kalish at the Kalish Institute. On that note, if you are a functional practitioner, make sure not to detox anyone who's pregnant. Let's not do any gut-killing protocols at this time. So, those infections in the gut, want to just kind of leave those be. Unless it's something so severe that they need to be seen by a medical practitioner, then that's kind of a different thing. And then just avoid herbs in general. I avoid herbs. Some of you may work with herbs, but you do need to verify that they're safe in pregnancy, and many of them are not. In fact, here's a list of things that are absolutely contraindicated in pregnancy. So be sure not to use any of these. I won't read them to you, but here's the list. Many of them cause abortions. We just need to be very careful in using them. Any other herbs, you're just going to want to verify on the natural medicines database as well before using them. So stress can trigger inflammation. It upregulates the inflammatory cascade, disrupts the hypothalamic pituitary adrenal axis, and it imbalances the immune system. Plus, there's those intergenerational effects that stress can have on epigenetics. So it's really important to protect babies from that by helping parents reduce their stress and discomfort. Things that are safe in pregnancy, aerobic activity is absolutely safe. It's actually shown in studies to produce a positive effect on fetal heart rate and fetal heart rate variability. If you are a person who can help with sleep disturbance, we do want to work on that because sleep disturbance can lead to depression, preterm birth, stress, and it can shorten certain telomeres as well. So please refer to your sleep medicine doctors if you're noticing any of that. And if you're an acupuncturist or other type of body worker that can help with sleep, definitely address it. It's a great time to jump in. We also want to bring in our mind-body practitioners like our yoga therapists, our meditation teachers, and all of those great people that can help with stress. In fact, there are studies on infants done in, I think it was by Chan et al. On Chinese maternal fetal pairs, showing that in fact, with 6 meditation sessions, these maternal fetal pairs reduced their stress such that the infants showed lower cortisol levels. So it's really helpful in supporting newborn and also pregnant people care. Lastly, don't forget about community support. This is where all of my allied health professionals come in, right? My doulas and midwives and amazing practitioners doing work like acupuncture and acupressure and all of that. And speaking of them, we do want to empower parents to have an amazing birth plan. So a lot of midwives, OBs will do that, and they will help guide parents through their options during birth. So for example, thinking about where would they like to do the birth, home or hospital? Would they like to utilize certain positions at birth? Would they like a partner in the room? All of these questions, and they can really help guide parents through that. From a pediatrics perspective, I want to make sure that parents have planned for a pediatrician. So a lot of people forget that after the baby's born, they do actually need a pediatrician. So this is a great time to recommend to your patients, go ahead and do those meet and greets so that you can find a pediatrician that is aligned with your values. Also, it's a good time to think about some of the things that happen after birth that oftentimes people don't think about until the last minute. So let's make sure that parents have thought about, do they want to circumcise? Do they want to delay cord clamping? Do they want to do skin to skin? You know, all of these questions about after the baby's born, vitamin K, eye creams, all of this, and that they've had a chance to discuss that with their partner prior to having to make a decision on the spot. Another thing I want to talk about are environmental toxicants. So this is something that extends from the pre-pregnancy phase well into after the baby has been born. And so there are a lot of pediatric health conditions that are associated with environmental toxicants, including asthma, ADHD, breast and other cancers, autoimmune disease, reproductive disease, endocrine disorders. And this matters because certain populations, due to socioeconomic issues, increased sensitivity and timing of exposure and dose of exposure, are more vulnerable. For example, newborns, right? So newborns have increased sensitivity because they're newborns. They also have increased relative exposure to toxicants because of that surface area to volume ratio. They're small. And in addition, they're getting more exposures or multiple routes of exposures through the placenta, the breast milk, and also after birth as well. So here's an early landmark study that we can then look at that points to this issue. So in fact, the Environmental Working Group, in conjunction with Commonweal, took umbilical cord blood from 10 babies born in 2004. And what did they find? They found that 287 chemicals were identified, 180 were carcinogens, 217 were neurotoxins, and 208 were actually associated with abnormal fetal development in animal studies. And these chemicals included organochlorine pesticides, brominated flame retardants, polyaromatic hydrocarbons, and perfluorinated chemicals. So we do want to make sure that we're giving parents some strategies to help reduce exposure. When we're talking about air pollution, there's two different types of pollution. One is criteria pollutants, and these are pollutants that are actually measured by the air quality index. And that includes things like carbon monoxide, sulfur oxide, nitrogen oxide, ozone, and lead. And they all cause things like angina or have been linked to angina, asthma, cardiovascular events, and lung damage. Lead, of course, disrupts oxygen transport, thyroid hormones, and cellular functions. And so that's tracked by the air quality index. Then there's the hazardous air pollutants group. And this is a group of 188 chemicals that are linked to cancer, birth defects, respiratory neurologic diseases, et cetera, and includes benzene, formaldehyde, polycyclic aromatic hydrocarbons, mercury, asbestos, and cadmium. So make sure to advise parents to go ahead and check that air quality index and avoid exposure on outdoor poor air quality days. Also, don't exercise or be, walking by busy streets. And when you have your child with you, make sure to avoid idling buses and cars, or even if you're pregnant yourself, you want to avoid that in general. So make sure to avoid that. Make sure patients know that they should have the house checked for radon. Carbon monoxide detectors do need to be installed, and they should avoid toxic exposures to indoor air quality issues like chemicals, particle board, adhesives, high volatile organic chemical flooring, carpeting, all of that. Another thing to do, of course, is make sure no one's smoking around baby or yourself while pregnant, and get that HVAC checked on a regular basis. Regarding land pollution, this comes from sources such as manufacturing and agricultural release of endocrine disruptors, and that means BPA, phthalates, pesticides, and flame retardants. These endocrine disruptors actually interfere with hormone and neurotransmitter development, and health effects include reproductive issues, infertility, abnormal sex development, miscarriage, PCOS, ADHD, to name some, and there's many more. So be sure to make sure parents know to look for these recycle labels. So recycle label 7 means polycarbonate, and that often means that there's BPA in the product, and polyvinyl chloride. So number 3, so recycle label number 3 often means that there's phthalates in the product. So we do want to avoid that. And for the same reason, avoid using plastic containers or microwaving food in plastic containers as well. We can encourage our patients to look at the Environmental Working Group database to check their cosmetics, products, personal products, and pesticides. And of course, with food prep, some people really think that it's okay if their food's organic not to wash it, but we do need to wash it and peel it to get all of the things off of the food. And then with animal products, we do want to trim the fat to get rid of toxicants that are stored in the animal fat tissue. Last but not least, the chemicals, we want to try and use non-chemical pest control and as much as possible eat organic. When it comes to the water, so there is the Clean Water Act, thank goodness, that does regulate microorganisms, disinfectants, and its byproducts, organic and inorganic chemicals, as well as radionuclides and perchlorate. However, there's 200 contaminants that include antibiotics, antimicrobials, persistent organic pollutants that remain unregulated. So again, make sure parents know to use this database to check their water, the EWG, get those wells tested, which are obviously unregulated. Don't use water bottles because those are held to the same standard as tap water. And now they're in that plastic bottle that we know as an endocrine disruptor. And also make sure they at least have a charcoal filter that they're using. So now we'll shift briefly into the postnatal and newborn care. As you can see, the list is similar, but there's some significant differences that we will talk about. One thing that I'd like to touch on is this idea of busy. So a lot of parents are, birthing parents are expected to rush back and do many things, cook and clean and take care of the newborn, sometimes even go back to work. So when at all possible, please encourage patients to plan for help during this time period, this perinatal, this postnatal time period. And in many cultures, they in fact encourage a 40-day period of rest and bonding with the baby, and that can be something that's really special and helpful. So in addition to the follow-up with midwives, we also want to make sure we're addressing mental and emotional stress in postpartum parents. And there's many screeners that you can use for this. The Edinburgh is one of them. And if you are noticing anything like that, be sure to refer to a therapist or counselor or psychiatrist of some kind. Chest feeding. So we're now using the word chest feeding, if you didn't know that, instead of breastfeeding for many reasons. But to talk about it a little bit, parents that are chest feeding do need an additional 340 to 400 calories a day. They also have an increased need for protein, calcium, vitamin D, and other minerals, as well as 128 fluid ounces of water. So this is a good time to discourage patients from quote unquote trying to lose the baby fat, because in fact, chest feeding will naturally help with that process. And parents do need additional nutrition during that time. I'll just touch on briefly the milk production herb fenugreek. So many people do use fenugreek to help increase the milk production. And most brands come in the 580 milligram to 610 strength, and you would just take 3 to 4 capsules 3 times a day. For parents not able to exclusively breastfeed, there are human milk banks available. They're not very budget friendly, so sometimes we do have to switch to safer formula, safe formula choices, which we don't have time to discuss today, but happy to answer questions on. We do want to encourage babies to be, or parents to feed their babies up until 6 months of age. via breast milk only exclusively, so that they don't miss out on this rich microbiota and prebiotics that we find in the breast milk. When it comes to newborn herbs and dietary supplements, there's 4 that come to mind. So there's not much that we're giving newborns, but DHA is very important. So again, we want to support those omega-3 levels so that we're supporting the immune balance, reducing risk for allergy, and reducing risk for asthma. There's not a specific range in mind, but breastfed parents, as I said before, can take that 200 milligrams a day. And then older babies, 1 and up, there's a suggestion of 0.6 to 1.2 grams a day for older infants. Vitamin D, this is really important for bone health, calcium metabolism, and immune function. So in babies not consuming 16 ounces of formula a day, they do need 400 IU of vitamin D per day. Chamomile tea, this has been used traditionally as an antispasmodic, anti-inflammatory, and calmative herb. It's often used for colic and diarrhea in traditional cultures. There's no specific dose, but people have been known in these traditional cultures to use 2 to 3 ounces a day of that. Avoid if the patient is allergic to asters like ragweed, chrysanthemums. There's a lot of talk about probiotics, and studies are ongoing. In the altered microbiome, we do know that in cases where people have had C-section or have had antibiotics and the microbiome has been altered, there could be a link to necrotizing enterocolitis, inflammatory bowel disease, obesity, asthma, and autism. And so although there's not a probiotic dose that's recommended, we do know that a diverse exposure to bacteria, like on a farm, can help reduce things like asthma. Probiotics are generally considered safe over 6 months old, although there have been some studies using Lactobacillus reuteri for colic and diarrhea. Please use caution, especially in premature infants, less than 1,000 grams, sick infants, and immunocompromised infants, because more safety research is needed in these groups. Gentle sleep practices. So in fact, we can see stress during C-sections. So there have been studies showing that babies born vaginally have about 51% of active sleep and 38% of quiet sleep. And babies that have undergone C-section often have less quiet sleep, probably due to stress. And things that we can do to help support this would be infant massage, which has been shown to regulate stress hormones, improve heart rate variability, bone density, among other things. Aromatherapy with lavender. Music therapy, which in NICU babies has been shown to calm the baby and stabilize vital signs and also increase weight gain. And also therapeutic touch. Last but not least on this topic, bonding. So there's many ways to bond with baby. Baby wearing is one of them, and a lot of cultures use this to bond with baby. And in fact, studies have shown that babies cry about 43% less when they're worn in this way, rather than just pushed around in a stroller or left in their crib. So encourage nurturing and emotional bonding. We'll touch very briefly on some common newborn conditions listed here. Colic is one of them. This is excessive crying and irritability. If mom's breastfeeding, be sure to look for common irritants like dairy, caffeine, spicy foods, etc. Gentle soothing techniques like rocking, white noise, and massage can help relieve the gas, especially in the abdominal area. Again, that chamomile that we talked about. Some people use lactobacillus, and then of course, body work like osteopathic, chiropractic, etc. can help with colic as well. Diaper rash, we want to use things like chamomile, coconut, shea. Butters as a barrier cream, zinc oxide is also an option. Let the diaper, get the diaper off and let the booty breathe to the air. That helps as well. And of course, you can use natural antifungals like grapeseed extract, 5 drops in an ounce of water, just sprayed on the bottom, and calendula as well. If diaper rash gets really bad, we may want to evaluate for food sensitivities, particularly dairy. For GERD, we want to make sure those babies are feeding more frequently in smaller amounts and are held upright for 20 to 30 minutes after feeding. They're positioned at an incline after feeding, and that we are are eliminating any maternal triggers like caffeine, dairy, and soy. Again, this is another area of research regarding probiotics. Lastly, we're talking about cradle caps. So these are those often oily, crusty patches on the scalp. And we do want to recommend that we wash the baby's scalp with a mild fragrance-free shampoo. We can massage it with coconut oil or olive oil to loosen those scales, and use a brush to gently remove the scales. Again, increasing omega-3 fatty acids. We keep hearing about that. They're so important. That will help with cradle cap as well. Some people also use the homeopathic Calcarea carbonica. So the holistic pediatrician, we have so many roles, from integrating our conventional care. I use conventional care, integrative care, osteopathic, functional, and all of these modalities to help coordinate care and partner with my patients. These are my references, and lucky you guys, I am offering anyone who is seeing this talk or their patients a 20% off my first functional discount. It expires January 1st, so get in soon. And again, that is for North Carolina, California, and Florida, South Carolina, hopefully soon when that license comes through. And this is my contact information where you can reach me.
All right, I'm going to do a summary and then a couple of questions for you. So we started by saying, what is holistic care? It's physical, social, mental, and spiritual health, emotional support, and family involvement, combining holistic as well as conventional care. So with prenatal, looking at pre-pregnancy health, nutrition, weight management, stress reduction, community support, supplementation, reduced discomfort, environmental toxins, looking at safety planning and birthing planning. And with nutrition and supplements, I'm looking at a prudent diet prenatally, so also increasing folate, so about 600 milligrams per day, protects from neural tube defects, and not folic acid because they may have the mutation. And then DHA, about 200 milligrams per day, two servings of fish per week for brain and eye development, and then also to help with reducing preterm birth. Amino acids such as tyrosine and tryptophan can help also with brain development. And then functional supplements, pre and probiotics, multivitamin, omega-3s, pancreatic enzymes, gallbladder support, and well as minerals. Do not detox when the mom is pregnant, and then also avoiding herbs. And then with stress, it can cause inflammation and intergenerational effects. So looking at physical activity, sleep, mind-body practices, as well as community support, all to help manage stress, and of course, address sleeping. With birth planning, so empower birthing parents to feel educated about all of their options. Plan for a pediatrician for after the baby is born, and then find someone aligned with your values. Things to consider, there's so many things to consider, just some examples being circumcision, cord clamping, skin to skin, and then vitamin K. And pediatric health conditions associated with environmental toxins, so things like asthma and ADHD, breast and other cancers, autoimmune diseases, reproductive health, and endocrine disorders. You shared with us a great study regarding umbilical cord blood, and this was a very large study, and they found carcinogens, neurotoxins, and chemicals were all found. So recognizing that we need to limit our exposure to toxins. And so you shared with us air, land, and water pollution. So with air pollution, looking at air quality index, avoid busy roads while exercising and idling buses and cars. Check house for radon, use carbon monoxide detectors, avoid toxic exposures, and no smoking, and definitely use the HVAC and make sure that it's nice and clean. And then land pollution, so polycarbonate, polyvinyl chloride, no plastic containers, don't microwave plastic, do food prep, non-chemical pest control, and eat organic. And then water pollution, so EWG, test the wells, avoid plastic bottles, and utilize water filters. And then postnatal newborn care. So holistic care for new birthing parents, rest and bond and connect with the baby for about 40 days, and then follow up with midwives and OBs after the baby's born, and then manage postpartum emotions and mental health. And chest feeding, so increase protein and water intake for parents, help with natural weight loss, and then breast milk exclusively for 6 months for the baby. And then supplements for the newborn, including DHA, vitamin D, chamomile, and probiotics. So especially a C-section or altered microbiome from antibiotics, probiotics can be beneficial. And then gentle sleep practices, so creating a calm sleep environment, less quiet sleep with C-section, so even less quiet sleep for newborns who have had a C-section, so making sure that we're having good sleep principles and practices, things like aromatherapy, massage, and music therapy. And then bonding, skin-to-skin contact, also infant massage, wearing the baby has been associated with less crying. And then common newborn conditions, colic, looking at maternal diet, soothing techniques, herbal support, and body work. For diaper rash, chamomile, coconut, shea butter, shea, take diaper off, as well as natural antifungals. And then for GERD, hold the baby upright after feeding, eliminate caffeine, dairy, and soy. And for cradle cap, wash with mild fragrance-free shampoo, light brush, as well as omega-3 fatty acids. Thank you so much for sharing these great tips with us today. A couple of questions for you. We did talk very briefly about formula. How would a mom know if a formula is safe, especially if she's having problem with chest feeding? What does that conversation look like for education? And then how would she know if a formula is safe for her baby?
So the FDA does keep track of formulas in the US. So there's different formulas that people can get, from dairy-based to soy-based, all the way to fully hydrolyzed formulas. And depending on what your baby's experiencing, you'll want to ask your pediatrician which of those is the most appropriate to use. Some babies who are sensitive to dairy are also sensitive to soy, so it may not be the best choice, and therefore moving to something more hydrolyzed like Nutramigen or Alimentum can be really helpful. In general, the FDA will keep track of how all the formulas are and will alert your pediatrician if there's any issues with the formula. So if you can find a regulated formula in the US, you're usually in good hands. People ask me all the time, what are my favorites? I like Bobby. It's one of my favorites, as well as Earth Best. There's a lot of formulas also overseas. Those aren't regulated by the FDA, so it's just a little bit trickier for your pediatrician to know if there's any issues with those formulas.
Wonderful, thank you. And as a holistic pediatrician, what does it look like in terms of a treatment plan when mom is pregnant and then through the follow-up? How often are you seeing? How often are you doing educating? What does that look like in terms of your setup when working with pregnant moms?
Yeah, so sometimes I'll even meet with people prior to them getting pregnant, just because I do a lot of functional medicine as well. And if that's the case, I'll do a full evaluation to make sure that they can get pregnant, especially things like cycle mapping, making sure their nutrition is on point, lifestyle, etc. And then I like to have, after that's all taken care of, I like to do at least one meeting to discuss what they're hoping for their baby in working with me in the future. And then once baby's born, you get to see me a lot. So usually between day 2 and day 4 of life. And then at 2 weeks, 1 month, 2 months, it's every 2 months after that, every 3 months after that, every 6 months after that. And we basically become best friends. So you'll see me quite a bit.
Excellent. And I want to encourage everybody to go back. Be sure to scan that QR code and tune in and follow all that Dr. McGregor is up to. And as we wrap up another great session today for Peds Week Online, I'd like to acknowledge Dr. McGregor for her excellent work in pediatrics. I'd also like to acknowledge you, the healthcare provider who's learning up-to-date clinical solutions to serve your pediatric patients at the highest level. I'm Dr. Krista, your host for Peds Week Online. Be sure to get the Pediatric Clinical Pearls Super Pack for ongoing summit access and tools for simple implementation into your practice. Stay tuned, and we'll see you on the next Pediatric Masterclass for Peds Week Online.